Hello, everyone. My name is Callie Geldis. I'm Senior Director of Communications and Content here at Weave. I'm really excited to be joining you guys today to be talking about the 2023 Healthcare Business Insights Report. At Weave, we are obsessed with bringing you great products and services that help power your practice, keep you modern, and keep you communicating with patients wherever they are. But part of that is staying ahead of what they want. So today's discussion is going to be all about what do patients want in 2023? What are the things you guys are already feeling really acutely in your practice? And what are some of the things that you can do to stay ahead of the curve and make sure that your patient experience is top notch across the board? To give you a sense of what we did, we went out, we'll cover a lot today. We'll talk about where you have been since COVID, the state of small healthcare, exactly what you were experiencing after the pandemic, and bring that forward to 2022 and 2023. How have things changed? What has evolved in the average small healthcare practice? We'll also go into some really key trends from our survey. And to give you a sense of the methodology, we commissioned an independent market research firm to study 360 healthcare providers across the United States and over 1,000 patients in winter of 2022. We did an online sampling, and what we found was, although there are some new challenges hitting practices, many are already adapting to these changes through modernization and investment in some high ROI tech. I'm really excited to talk to you about the patient experience gap, though, in particular. So let's dive on in and start talking about some of the results of the findings in the survey. So going back to 2021, 2022, as patients started to return to the office, providers had adapted already. You know this really acutely in your practice. You were already adapting the tools and services that you need to do things like curbside check-in, more texting, more contactless payments to avoid spread of COVID in the office. And texting was really a huge aha moment in 2021 for a lot of practices. And they started adapting it at a much higher rate. To give you a sense, when we did the same survey back in 2021, what we found was only 18% of providers said that they were using texting to its full potential. That has changed. You are all over text messaging and how to use it to communicate better with your patients. But at the same time, you are also trying to meet patients who have a higher expectation for care. So to give you another great look back for a moment, in 2021, small practices were nearly 7 times more likely to say COVID-19 had improved their quality of care than to say it's gotten worse. So you were adapting right alongside as your patients were adapting to the new normal of COVID. As we've seen over the last year or so, COVID hasn't been the number one thing on everyone's mind. It surely hasn't been for us here at Weave. We've been really focused on some of the newer challenges in your business. And what was really interesting is that as you saw patients return to the office, you may be providing even better care than ever before, but patients were responding to that and expecting better across the board. If their optometrist was using text messaging, they were expecting their dentist to do the same. If their dentist was using appointment reminders, they were expecting that veterinarian to use it as well. And so as that became the new normal across so many different healthcare practices in the space, there were plenty of people who weren't ahead of that game that have been trying to play catch up over the last year. What's interesting is that when you look at that attempt to catch up combined with some of the macroeconomic factors that have really been top of mind for practice owners and providers this year, we see that this is a continued trend, but a little bit different, a little more acute for the practice because they've been dealing with different challenges like inflation, staffing shortages. We'll dive into that a little bit more today. And I'm really, really excited to kind of bring you key challenge in 2023. There's one big theme from our survey and our research that we found. Again, we talked to 360 healthcare providers, and this was kind of the summary, the thesis of all their feedback. You are feeling pinched by higher costs in your practice and a higher patient expectation. You're being asked to do more, maybe with less, as staffing has become increasingly difficult. And while you have been adapting, and I'll go into how you've been adapting a little bit later, it's still a frustration point for many practice providers. It feels like it's never enough. And that's creating an expectation gap between patients and providers, which is really, really being acutely felt in the business. I'll dive right into key trend number 1, because this is exactly my point. Patients are raising the bar for small practices. When you look at the data that we pulled in our survey, one thing became really clear. Patients and providers are a little bit stressed with one another right now. There's a little bit more tension than there has been before. What's surprising about this is I think many people would expect that tension to have really peaked during COVID. It has remained, though, over the last year. And again, I point back to across the board, as many practices modernized, there were still some that hadn't. And so the expectation of what a provider should do to communicate with their patients, to set appointments, to collect payments across the board, that has changed significantly in the last year. And we are seeing a lot more patients become frustrated with providers that aren't keeping up with the pace. One really great stat from our report that I want to call out, 51%, so a majority of providers say patients are less reasonable than 12 months ago. What's really interesting about that is that patients are expecting you to meet them where they are. They are accustomed to the convenience economy. That's the same thing that you experience yourself as a consumer. If you're a provider, you're also, door dashing food. You're also going and doing Target curbside pickup for deliveries. You're able to get packages and items delivered same day to your door when you order on Amazon. That convenience economy is really having an impact on the patient expectation, because they don't differentiate between you, their healthcare provider, and the retail stores that they're going to on Main Street. You're part of the small business community, and they are really expecting you to deliver on a modern experience that they are starting to become accustomed to and see as table stakes in their experience in a practice. What is really interesting, though, and I really want to call this out, is 95% of patients say they trust their provider. You are an incredible resource to your patients. They love you. And you have to keep them loyal. One of the things that we'll talk about a little bit later on is the importance of loyalty in the practice in 2023. As a lot of patients deal with their own economic uncertainty. We are seeing layoffs. We're seeing a little bit more of a economy that people don't necessarily, they're maybe a little bit more fearful than they have been. Patients are still really committed to going to you as their provider, but they also need to be able to get in on time. They need to be able to schedule an appointment easily. If they see someone else doing it better, they may switch. One thing that I wanted to call out in particular is that we asked a new question this year compared to our survey in 2021. And that question was 40% was what is your number one hassle in your practice? We asked all of our providers this, and across the board, the number one hassle, 40% said demanding clients is their top hassle in their practice right now. So it's a perfect example of that patient expectation bar just continuing to be ratcheted up. What was also interesting was second, and very close second, was insurance claims. That came in at 38% of providers said insurance claims was their number two hassle in their business, pointing to a real need to streamline the insurance process in your practice, both for staff and for patients. And then a not so very close third and fourth were billing issues and client intake forms. What I get excited about when I see that is that insurance claims, billing issues, and client intake forms are all things that Weave can help power a solution for in your practice. Let's dive a little bit deeper, though, into how you can really take that trend and make some actionable changes in your practice. So this is the marching order for you. Patient expectations are higher. You need to modernize your practice operations to stay ahead of the curve. I talked about loyalty earlier. 78% of patients haven't switched providers in the last year. I think that's a really important stat. You have a lot of patients who are already incredibly loyal to your practice. They know the care that they expect. But at the same time, you could look at that a little bit differently, right? 22% of patients say they have switched providers in the last year, at least one provider. And I think it's good to note that as you look at your practice, retaining loyal patients is really important. Probably more important this year than attracting new patients. But as you know, keeping your chair full has to be a combination of both. If you're an established practice already, you have a broad patient base. Maybe their insurance has changed. That might be a reason that they're leaving your practice. And that can happen, especially in a more turbulent economy. That can happen more often as patients, change jobs a little bit more frequently. It's really important. Ongoing communication is really important to keeping that patient base loyal. The second thing I want to call out as an action item, gather feedback. Patient expectations are changing. Are you clear on what your patient's expectations are? That's a really key question. If you're sitting in your seat right now saying, I don't know. Or if you're sitting in your seat saying, it's been a little bit of it's been a beat. It's been a second since I've actually gone through and read some of the reviews we've been collecting on Facebook or on Google. You need to take some time to really look at what are the challenges in your practice. And also you need to do a little bit better, use software, use tools to better collect reviews of happy patients, because patient reviews of your practice provide visibility for new patients who are deciding whether to join, to use you as a provider or not. So automating reviews to keep your practice visible and to benchmark and train staff is going to be really important. I'll talk about staffing here in a minute. I think that's another incredibly key challenge facing the industry, right, in the healthcare industry right now. But one of the most important things on gathering feedback is not just gathering it, looking at it, reviewing it, but then pushing it back to your staff and your team members so they understand the pain points of the customer, of the patient as they walk into the office, especially if you have a new staff members. One of the things, again, we'll talk about in a moment, is staff changes have been rampant in the healthcare industry over the last 2 or 3 years. In 2022, as COVID calmed down, I think a lot of providers were really hoping that staffing changes would calm down as well. Unfortunately, because of inflation, because of burnout, that hasn't been the case. And the data proves that out. So training new staff and even staff that have been with you for over a decade, it's incredibly important that they are in line with what experience you want to deliver in your business, because you can't be everywhere all at once. And they are a part of that experience in your practice. From the moment they get their first text message, their first phone call, to when they walk in the door, you want a seamless, you want a high quality, and you want a trusted experience. That third one I want to talk about how to modernize your practice operations to meet people where they are, your patients where they are. You need to avoid payments complexity. You're experiencing it from your staff. Like I said, that number 2 hassle was insurance verification. The number 3 was billing across all healthcare providers. Avoiding payments complexity means you need to make sure that you have all of the different ways that your patients want to pay. If you are a dental office, you may be seeing patients who range in age from 3 all the way to 93. And the way that those generations want to pay for services is very different. And as the payments landscape has evolved for healthcare providers over the last decade, and the payment options have evolved for patients over the last decade, there's some new tools that you may want to consider implementing in your office. One in particular is a buy now, pay later option. It's something we offer on the Weave platform as part of our payment solution. It's a buy now, pay over time product. And the benefit for patients is they can schedule a payment plan. They can spread that out over time. They can make sure that they're getting the care they need, that they're not delaying care. But the benefit for providers is that you don't have the onerous task of figuring out a payment plan with every patient that walks through the door that wants one. That is a highly tedious task for office staff. And when you're trying to improve expectations and across the communications sector of your business, you are already asking those staff members to do more, right? And so making sure that you're streamlining any tedious task in the business is going to be really important. We'll talk about that in a minute. But again, this key takeaway for everyone: modernize your practice operations to stay ahead of the curve. Key trend number 2 that I want to talk about, and I'm sure you're like, yes, staffing challenges have been acutely felt in my practice this year. They don't show any sign of letting up. And I'll talk you a little bit through some of the data here. First off, 51% of practices have raised their prices in the last 90 days. Inflation and wage inflation in particular are really driving a pinch on the wallet of the practice provider. They are seeing costs rise without necessarily being able to bill at a higher rate, especially because of some of the insurance contracts you need to maintain. So I want to point out one thing, and we can go through this in a moment. We've asked our respondents, to our survey, which business expenses have increased the most over the last year. We asked them to pick across the board. And number one was utilities. No surprise there. Rising energy costs, utilities. Maybe you're trying to stay open longer, have longer hours in the practice to meet the demands of busy patients. But second, wages. Wages was that second most common price increase in the business, cost increase in the business. Third was technology. Fourth was hardware. Supplies and rent continue to stay in the mix. But I think it's really important to call out that wage increase it was across the board, something that we saw with all of our providers, did not matter the vertical. It is really tough to retain staff. We also saw that providers are adapting to this already, right? Our survey showed that 47% of providers have raised wages in the last 90 days to adjust for cost of living increases. So if you have not adjusted for that in your practice, that's something that is a decision you can make, but it's one that may make it more difficult to retain staff. Luckily, I have a kind of silver bullet to help you retain staff, because there is one thing that we really found. And again, this is in a different survey that we conducted this last year, but 26 of providers have said that an employee has quit because of frustration with tech used in the office. And more than half of our respondents that we surveyed, half of providers said that having the latest tech makes it easier to retain good employees. So it's really important. A staff member may stay. Maybe they're not getting paid as much as another doctor's office down the street, but they may stay because their job is a little bit easier. They're a little bit happier for those 8, 9, 10 hours a day that they're in the practice, because you have the right technology to make their life a little bit easier. We hear it all the time when we talk to office managers, the users of our platform, that tedious tasks are just one of the most annoying parts of their job. Anytime we can streamline a task for an office manager, a receptionist, a provider, that is a focus for us. That's a problem that we like to solve. And one of the really interesting things was, again, more than half the respondents we surveyed, 65%, said that having the latest tech makes it easier to retain good employees. I know that you are so focused on patient experience that often staff experience comes at a secondary to that. But I think that's a real risk to think about it in that way. They are really tied together in the practice. Retaining current staff who know your processes, know your systems, know the faces in the business, know the patients that are coming back every 6 months for a checkup. Those are the staff that can be an incredibly powerful tool to improving patient loyalty. If a patient has a great experience with that front desk receptionist, and that front desk receptionist, knowing that they come in that day, uses Weave to look at the patient list and greets them by name the next time, it's an incredibly friendly experience. And that really is what patients are demanding these days. That is that new patient expectation. One of the things I also want to call out is that a lot of providers are concerned about staff and being overextended. We did find that 15% of providers are concerned that they'll have to conduct a layoff in the next 12 months. And so doing more tasks with less means you have to embrace automation. There's really no other way to do it. So what you can do, remove as many tedious tasks as possible from the business. Patient intake forms, go digital first. Let me walk you through this from a patient perspective. A modern patient journey is very different than it was 10 years ago. 10 years ago, it was very common. Come into the office, get that clipboard, fill it all out, pens getting lost all the time, so many errors potentially, or, I have horrible, messy handwriting. I can attest to the fact that filling out patient forms for me is a bad in-office experience. I hate it. I'm sure I feel pity for anyone who has to read my patient intake forms when I have to fill them out. And so going digital first does a few things. First off, it makes that intake in the office a lot easier. You can send that text message with a digital form that they complete before they even set foot in the door. Everything's done. You feel better prepared for the day as a provider. Your staff feels better prepared for the day. They can prep the providers really, really well. Say, hey, we have a patient coming in who, hasn't been to see the dentist in about 4 years. What does that mean? How do you prepare differently for those kinds of cases? It helps you just get ahead of the game on a daily basis. And the second is it also reduces the risk of medical errors in files, right? You don't have staff transcribing things and maybe making mistakes in the transcription. And then the third is it saves time. It takes a lot of time. It is one of the most loathed tasks of staff members in your office to have to go in and take those paper files and put them into your patient management system or your electronic health record. It's onerous. It's also costly for you, right? As the cost of wages have gone up, so has the cost of tasks like that, right? So streamlining the patient intake form process is really, really crucial. And it's one of the tedious tasks that you can leverage to make staff a lot happier in the practice. Second, insurance verification. I go back to that top hassles. Insurance verification second to demanding patients. That's the second most tedious hassle in the business right now. Using a verification tool and combined with digital intake forms allows you to collect patient information at the beginning of the appointment. They can schedule an appointment online with Weave Online Scheduling. Then you can ask them for that patient intake information with a text message, collect that insurance information, verify them before they even set in the office. It creates a wonderful, wonderful experience for the patient and for you as the provider, because you don't have to worry about your chair getting backed up. You don't have to worry about delays. You don't have to worry about staying an hour late at the end of every day because you've had this backup in the office consistently throughout the day. So it creates also just a happier life for you. And then that third is appointment confirmation. So this is one of those overwhelmingly patients prefer to confirm appointments via text message. I'll go into one of those data points here in a second, but it's also a way to avoid time-consuming phone calls for office staff. How many times are you asking office staff, confirm tomorrow's appointments, confirm the week's appointment ahead of time, and they're calling, the patient misses the call. They're trying to follow up. They cross 2 names out of 10 off the list for tomorrow, and they still need to go back into those other 8 because they weren't able to get them on the phone. That is time consuming, and it's time that could be better spent on some of the things that help you provide a better patient experience, like greeting patients when they come in the door, answering new patient phone calls if they have a question, answering current patient phone calls if they're following up after a procedure and have questions for the provider. It's delivering a top-notch patient experience doesn't necessarily mean doing more. It means doing more with less, and it means letting automation take care of the things that you just don't need a human being to be doing manually anymore. Key trend number 3, software investment. This is a really interesting one. I think whenever there's macroeconomic uncertainty, there's concern about rising costs, people go through their QuickBooks. You'd probably do this as a business owner. You go to QuickBooks, you look at your costs in the business, you say, yep, rent, yep, utilities, oh, software. What am I spending the most money on? And you look at those line items and say, what can I do without? But what you're not looking at is that can be penny wise and pound foolish. If you're eliminating softwares that are actually driving revenue and streamlining processes, you're not really thinking about the full downstream impact of what you're doing. So software investment is really critical and increasingly critical to reach those multi-generational patient bases. This can seem very frustrating. This is part of that patient expectation gap. So what our survey and research found is that 94%, overwhelmingly, this is as close to universal acceptance as you're going to get, I think, at any survey or research. 94% of providers agree that a text message reminder makes patients more likely to show up for their appointment. Software makes it easier, makes it faster to keep chairs full and patients coming back. So when you're thinking about a multi-generational patient base, again, that ages 3 to 93 patient base that you're dealing with, you have to think about they want to be communicated with differently. So, and you feel this already. We ask providers, how do you prefer to communicate with certain patient generational groups? 81% of providers still prefer communicating with older clients over the phone versus text and email, right? You're not getting rid of your phone number in your business. That's a given. You're going to have a phone number, but with young patients, providers want to use text message. 80% of providers prefer text message over phone calls and email messages when it came to communicating with younger patients. Part of that is because that's how they want to communicate too. So to give yourself the best chance of making sure that you're communicating across the board with patients the way they prefer and the way you prefer, it really is all about keeping software in the business that's going to help you meet patients where they are. And one of the things I wanted to call out is it's not just about communicating differently with the patient based off of what they want. It's also about choosing the right kind of communication for the right message. So this is a really interesting stat. When we asked, what do you use text for in your business? What are text messages better for than a phone call? Text messaging is the preferred method for appointment reminders, digital form reminders, and after hours questions. I love that third one, after hours questions. I'm sure you are feeling the pinch of feeling like you have to always be on. You are always getting calls. Part of this is you have a patient base that is busier than ever. All consumers are busier than ever before. That's why they love the convenience economy. They love curbside pickup. They love text message conversations. But it also means that they expect you to be able to respond quickly if they have an issue, even when your doors are closed. The closed sign, you flipped that open sign over and your phone goes straight to voicemail. So for after hours questions, I love this because I know a lot of you as providers want to make sure you're delivering the best patient care. That is a differentiator for you. That's part of how you stay ahead of the competition, is going above and beyond for your patients. Text messages are really important for that. Second, I wanted to call out what email is preferred for, right? Very different here, right? For text message, it was appointment reminders, digital form reminders, after hours questions, these very functional things. For email, it's all about marketing. Email is preferred for promoting new products or services. And then phone calls are the preferred method for scheduling appointments. So maybe there's a tricky situation. You have an emergency with Fluffy. You need to get into the vet as soon as possible. Scheduling an appointment is not so easy, maybe, to go the online scheduling and saying, oh, we're 3 weeks out. Maybe you have an emergent issue that needs to be handled as a patient. So phone calls are really preferred method for that. And providers prefer that as well. The second is for follow-up questions, right? Maybe you got a cryptic message from a patient. Maybe they have a question about what kind of insurance you take as a business. Follow-up questions, phone calls, sometimes are that faster, easier thing to do in the business, but it takes time, and you can streamline all of these other tasks and save your phone calls for what patients want and how you prefer to use them. And then also for phone calls for collecting payments. What I think, if I have a prediction, my crystal ball, is that next year we'll see this change pretty significantly. We see a lot more healthcare practices adopting to new payment collection methodologies. So text to pay, Apple Pay, Google Pay, card not present charges, collecting HSA cards in digital intake forms and doing recurring billing. There's so many advancements being made in healthcare payments right now. This is a really exciting one that I think we'll see phone calls and the use of phone to collect payments go down significantly, and we'll start seeing that pop up for text messages. So a few things you can do: revamp your morning to-do list, because here's the deal. Creating more automation in the business across the entire patient journey is really what's crucial. When I say revamp your morning to-do list, when you update to a new software, you need to make sure your staff is fully trained. One of the things that we are seeing is that with many offices, you've had this staffing shift. Look at the people in the room that are powering your practice right now, that are helping it function. If you have a lot of new faces in there that weren't there a year ago, you need to make sure they are fully trained on your products and services. This is an important investment. An hour of training can make them more efficient. You're going to get a ROI on having them spend that time in the business. Also, really, I talked about patient loyalty a lot. Focus on reaching your current patients consistently. Are you sending them emails? Are you texting them regularly? Are you following up if it's been a while since they've scheduled an appointment? Are you asking them about certain life changes? Maybe they were pregnant the last time you saw them and you want to follow up and see how the baby's doing. These are those delightful moments for a patient that will keep them coming back. And you can automate so many of these moments. The third is streamlining your payments. I talked about this a lot, but collecting outstanding balances faster is going to be crucial. We hear from a lot of offices that the billing specialist role isn't just a billing specialist role anymore, that you might have a front desk receptionist who's doing billing. You might have a billing specialist who's handling phone calls. You're asking your team members to flex in and out of their role on a regular basis. And so getting everyone trained on how to collect payments faster and really making sure that everyone in the business takes some ownership of collecting on those outstanding balances is really, really important. And again, as we see these more modernizations in payments and the products that you can use to do that, there's opportunity for you to automate like there never has been before. And one of the things I want to call out in particular is that 31% of providers are seeing an increased interest in payment plans from patients. So you have more people asking for payment plans. Payment plans can be extremely onerous, right? They take time to set up. It's not great for the cash flow of your business. I'm sure your CPA, your accountant is probably saying, I don't think so. And so giving them more options to pay can help make sure that you're collecting faster. And that can be really easy through automation. So making sure that as the economy impacts your patients as well, you're adapting and changing quickly is going to be the name of the game this year. Before we wrap up, I want to just call out one thing in particular. We conducted all of this research, 360 providers, over 1,000 patients across the U.S. But we brought you here today some broad healthcare business insights. What we've done is a deeper dive. So if you are in a specialty like your dental office, your optometry practice, you're a veterinary clinic, you're a med spa, you're a physical therapy practice, we have some ebooks that I want to draw your attention to. I gave you a very high level overview of some of the trends today. If you go to getweave.com/ebooks, you can find vertical and industry specific insights into what's happening in the vet industry this year, what's happening in the dental industry this year. And then as well, I mentioned a lot of products and services, Weave online scheduling, Weave payments, missed call text, the appointment reminders. These are tools that can help drive your adoption and modernization in your practice moving forward. Adaptation is going to be the name of the game this year. There's no one who has a crystal ball and can predict what's going to be going on in the economy. But what we've seen in 2022 and what we're going to continue seeing and what practices say they're going to be doing in 2023 shows that staffing is going to be a key issue. Adjusting to patients and their demands is another key issue. And that modernization and investing in software that has a really clear ROI. Those are three key trends that are going to be hitting your practice this year. I hope you've had a chance to glean some of those insights on how you can adapt and modernize your practice this year. If you want to connect with one of our sales representatives to talk about it, there's links right below, or you can go to getweave.com/demo. I'm Callie Geldis. I'm really happy to bring these insights to you today, and I can't wait to see what 2023 has in store for your practice.